right. Well, good morning, everyone, and thank you for joining us. I just want to, first of all, thank the participants of the roundtable that we had this morning for such an open and frank conversation. The nature of our conversation was just the impact that COVID-19, the coronavirus outbreak, is having on their businesses, on their organizations, the fear and misinformation that is rampant online, and how we can work together to better combat that fear and misinformation that's leading to, in some cases, very difficult times for the Chinese-Canadian community, whether it be at the business level, where people are seeing declined attendance at their restaurant or sales in their particular organization, or whether that be on an interpersonal level, where people are feeling extremely stigmatized in the community. And so we had a very good, frank conversation, and I'm very grateful also for the work of the community that they are doing to actually dispel the myths out there, but also support one another during this difficult time.
Thank you. Let's just take questions.
Okay, you don't. All right,
Yeah,
we're going to just
do
take
it.
questions.
Let's do it.
All right.
We don't have to do it.
Okay.
That works for me.
That works for me too. All right.
Minister Hajdu, can we talk about the Western Dam and the Canadians that have, some of them come back from that ship and sort of the status of trying to speak with some of those people? What should those people be doing if they're back in Canada?
So the advice is really the same as it would be for anyone traveling internationally at this point, which is that if you are noticing symptoms and you've been in an area where there is an incidence of coronavirus, or you've been in a close contained space like a cruise ship, that you should, if you're exhibiting any symptoms, out of an abundance of caution, stay at home, reach out to public health and tell them of your recent travel history. Obviously, we're working very closely with the ship's manifest to try and understand who has been traveling from that particular ship and what their travel path is. But it's an actual good reminder that in a global community where there is travel from a variety of countries, that this is not solely anymore an issue of an outbreak in China, that as this virus spreads around the globe, there is an increased risk to people that are traveling that they may come into contact with not just the coronavirus but other illnesses, and that the best course of action when you've returned from an international trip like that and you have symptoms is to stay at home and reach out for support and let people know that you've been traveling internationally.
So were you guys in the process of contacting everyone that was on that ship that's coming back to Canada, or are people, is it up to them to contact their local health officials?
So we're working right now to try and understand which Canadians have left the ship and what their travel routes are, and we'll have more to say as we understand that circumstance.
When, can I just ask a follow-up to that? So why were the two people that came back yesterday not told ahead of time they should be self-isolating? Basically what they told us was they were just told, wear a mask when you walk through the airport, fill out the immigration papers, and then they were sent off.
So I understand that that's their recollection. I have yet to understand the full understanding of what happened at the airport. I'm actually visiting the airport today, so I'll have a better sense from the public health officials at the airport today what exactly happened in that exchange. And it's also a good reflection for us to think about broadening our advice at the airport around, all international travel and what to do if you expect, you've been in a situation traveling internationally and you're feeling unwell. I think this is wise advice for anyone at this point who's traveled internationally. Certainly there's other illnesses you can contract as well, but we'll follow up with our health officials at the airport and try to understand how the circumstances unfolded.
Can you tell us when the Canadians will be picked up from the cruise ship in Japan? Do you have any numbers of how many Canadians, and are they going to be stopping off and refueling at YVR again?
So I don't have direct, information yet about numbers. I know there's about 100 Canadians or so out of the 250 plus that have not responded yet in terms of what their intentions are. We'll be keeping you up to date in terms of the flight time and when we think it'll arrive. We anticipate it probably will arrive later this week, but we don't have definite arrival times yet.
And just curious, what are the numbers in terms of how much business has been lost here in Chinatown, and what steps are going to be taken in terms of trying to increase that business?
I can answer that. You want to go? Sure.
Yeah, so we've, part of the discussion today was to talk about the local impacts on business here. We've heard some restaurants that are losing 50, 60, 70% of business, which is very, very concerning to us because most of it is based on misinformation. So that's why these meetings and the work that's being done by both Minister Dixon and Minister Hajdu are so important because they're getting the right information out there. So, you know, we're encouraging people to you know, continue on with their regular business. Enjoy, you know, all the great food and other services that are offered here in Chinatown and other Chinese communities. Because at this stage, we're considering everything safe and you know, and we don't want these businesses hurt. We're here really to support businesses in the local community and who are suffering because mostly of misinformation.
Minister Dix, could you offer a comment in French regarding the conversations you had with the community this morning?
Premièrement, on a remercié la communauté, les chefs ici de la communauté et des autres pour tout leur travail avec nous, pour donner, disons, les bons renseignements à tout le monde. Je pense que c'est essentiel pour que tout le monde comprenne la réalité de la situation. C'est c'est-à-dire que le risque n'est pas élevé, c'est bas, mais il faut prendre des mesures. Et c'est ce qu'on est en train de faire. Et deuxièmement, que nous avons la détermination de donner les propres renseignements, s'il faut le faire quotidiennement, pour assurer les gens qu'ils ont tous les renseignements nécessaires. Et c'est une démonstration au niveau fédéral, au niveau provincial et au niveau municipal. Donc on a vu cette conversation. Bien sûr, on a discuté les effets sur la communauté, les effets sur les entreprises, etc. On a discuté de cela. Et je pense que résolu ensemble, de travailler ensemble pour assurer que tout le monde a les bons renseignements de la part de BCCDC, de Public Health Agency of Canada et des autres, pour assurer que tout le monde peut agir d'une manière saine, mais aussi continuer à participer dans la communauté. I'd just say, just in English, that I think what's really important, and I think we've had very significant cooperation, I'm very appreciative of the role of the media, the English language media, the French language media, the Chinese language media here in British Columbia, who have been very, very willing to work with us in getting information out there in the community. Organizations have done the same thing. I think that's very important. We are determined, anytime that there is a positive case, to let people know. And we've consistently done that, so people can be assured that that is going to happen every single time. Dr. Bonnie Henry is meeting with the media once a week and with the community once a week and doing much more to respond to specific media requests, particularly in the Chinese language media, to ensure that people have good information. We have to work together to continue to do that. That's the important thing. That is our ability as a public health system and as a community to respond to something like this. It's ensuring that we have a common understanding of information, that we fight fear, unnecessary fear, which is developed by effectively bad information, speculation that's not based in reality, and that's what we're trying to do. And I have to say, and I wanted to hear that, to express my appreciation for the federal government, because we work together multiple times a week to ensure that we're getting the right information to the public. The level of cooperation, I think, it's fair to say, I wouldn't call it unusual, but it's at a very high level, and I think it reflects the seriousness with which we take this issue.
Vous avez un exemple concret de conséquences pour les entreprises à Vancouver, les entreprises?
Oui, effectivement, on a parlé parce qu'il y avait le chef d'entreprise d'un restaurant ici qui a parlé d'une chute de gens et d'assistance à son restaurant, par exemple. Mais il ne faut pas utiliser de pourcentage parce qu'il faut travailler dans le domaine des faits, mais force est de reconnaître qu'il y a un effet négatif sur les entreprises. Force est de le reconnaître, mais de dire que c'est à un certain niveau, je pense qu'on n'a pas assez fait.
It's been very helpful to have the weekly updates that you sent from Dr. Bonnie Henry, and of course also the levels of government here today. How concerned are you though that it seems that WhatsApp messages and WeChat messages seem to be flying around way quicker than any media messages that we could ever
Well, I think it's emblematic of our time. I mean, you know, I think as a society, as a global society, are challenged with a rise of misinformation, a rise of rapid transmission of misinformation through social media and chat rooms, and you know, this isn't a new phenomenon, but certainly the speed at which it's happening is, I think, the new piece. We just need to continue to remind Canadians, and the media is doing a great job of that, of, you know, going to the sources where there is credible information. I think there was a very illuminating comment today that, you know, sometimes there are alternative agendas for misinformation. People sometimes drive fear because they like to. Sometimes they drive fear because it might result in a profit. You can sell more masks, for example, if you create more fear. You know, people sometimes drive fear as a way to cast aspersions on communities. And we've seen all of that in different contexts. But what I can say to, and through you, and through the great work of the media, is that there are legitimate sources of information out there at all levels of government, at the local public health level, at the provincial public health level, at the federal public health level. And as well, I can say that with all of the work that I've done at all levels, there is a commitment to transparency by all of the elected officials who are working very closely with the departments of public health at all levels to make sure that we have credible information, that we understand the evolving science, and that we're actually communicating that to the best of our ability to Canadians as quickly as we get it. And Canadians should feel reassured by the fact that our systems are working so closely in order to be able to do that. Well, I understand that there's some voices that would say that we should shut down the border to China. But I would say that Canada is following expert advice from the World Health Organization and working closely with allied partners like France and the UK and Germany, who have decided to take a different approach than the approach that the Australians and Americans have taken for a whole bunch of reasons. First being that it's much easier to support people from a region that's experienced such an outbreak if we know where they're coming from. And the evidence says that when you shut down a border like that, it gets much harder to actually detect where people are coming from because people are determined to get into a country or return home, and they will find alternative routes to do so. Secondly, the long-term implications of shutting down borders is one, they're not very effective in controlling disease, as in fact, they're not effective at all. And secondly, they actually long-term can create a greater risk to global public health. And here's why. China has been very open. Now, some will say, were they open enough and how fast were they open? But what we know is that within a week or so, they were letting the World Health Organization and therefore all of the partner countries know that they had an outbreak on their hand. And more than that, they were sharing the sequence of the virus, which was really important to other countries like Canada to be able to have the evidence to do the investigation and the testing in Canada. Imagine now if countries were to suspect that if they had an outbreak, the border would get closed, there would be sanctions economically, and all of a sudden that transparency that the world relies on in order to defeat viruses like coronavirus and protect the health of their citizens. Imagine if, in fact, countries stopped sharing that information. We would, in a global health sense, be in a bit of a pickle, if you will. And so this is the kind of evidence that we follow, the World Health Organization evidence that says do appropriate screenings, make sure that you're providing people the appropriate advice, do the contact tracing if you've had close contacts of someone with the illness, support people to get better, have sophisticated public health systems that work in an integrated way across your society. And that's why Canada is so well positioned and has seen relatively good control of cases here in Canada.
Two last questions, please.
For Minister Dix or the Mayor, you guys talked about the misinformation spreading online, meeting with the Chinese community today. Are you hearing any examples of like outright racism or discrimination in relation to this?
Well, we've seen some examples of that. We saw some, just this past week, which obviously I addressed at that time, graffiti that was negative. And we're seeing this in the community. We're seeing people's responses to one another. I would say, though, and I want to add this, that I think we're seeing a lot of generosity as well in our system. And this is our strength as a society. We need people when they have symptoms to contact us. And we do that by having trust and generosity. We've seen in the Chinese-Canadian community support for one another, especially organizations that have developed and are providing public services to people who have chosen to self-isolate. These are extraordinary gifts, and these moments allow not just to show the worst in society, but the best. And what we have to do, I think, is to encourage that. And we're asking, what we've asked today, and what I think we've resolved together today to do as well, is to continue to do our work in getting information out to people. I think that's critically important. The media plays a role in that, but we all do too. It would be nice if we had a very significant social media response, and we do. Every time Dr. Henry here in British Columbia or Dr. Tam in Canada makes a statement, we make every effort to get that information out, not just in English language social media, but in other languages. I think we've got to continue to make that effort together, because there's another way of going about this. There's another way of responding to public difficulty, which is to encourage our work together to support each other and help each other. And I see an enormous amount of that as well. And we have to continue to encourage that. That's what makes, I think, our country great. And that's what makes is the strength of our response. Some people say, when we talk about tolerance, that that's not a strong response. It's the strongest response. It's what makes us so effective in responding to these issues. And I'm very, very proud of many people, and particularly in the Chinese community, but in the community at large, who are responding generously, who are getting the right information, who are supporting one another through a time when there's uncertainty and fear. And when there's those things, there's always the recipe for other problems. So.
I just wanted to go back to the Diamond Princess, so the story was the people that are coming back, because they're coming essentially from a hotbed of coronavirus, are there going to be additional screening procedures for them? And are the 12 people who were tested positive, are they going to be able to make it on a
Well, thank you very much. So we will be following almost identically the process that we followed when we repatriated people from Wuhan. People that are ill will not be allowed to travel for a whole bunch of reasons, one of them being that their condition may be too fragile to travel. When people are boarded on the plane, they'll be monitored for any symptoms, and if they become symptomatic on the plane, they'll be isolated on the plane in an area that will be designated. And when they arrive, they'll be screened again. People that are ill will be transferred to the health system using appropriate infectious disease protocols, and the people that are on the Diamond Princess right now will be subject to an additional 14-day quarantine when they arrive later this week. Thank you. Thank you very much, everyone.
Thank you.